I'm Grace Marie Turner, president of the Galen Institute. It's a pleasure to be with you, and I'm joined by Sally Pipes, who's the president of the Pacific Research Institute. And we are delighted that you are here and delighted to have an opportunity to talk with you about this frightening law that we all believe is going to have such a terribly detrimental effect on both our health sector, our economy, and our freedom. I'm going to talk first, and I have a few slides, so I'll be moving over to the podium, and Sally will then follow up. Both of us are somewhat, Rush called us authoresses. I wrote a book called Why Obamacare is Wrong for America, and Sally wrote one called The Truth About Obamacare. We'll be talking about some of the things from our book. So I'm going to move over to the podium and begin presentation. Welcome, Sally.
Thank you, Grace Marie, and we're delighted that all of you are here to hear our messages.
I think it's important to recognize what's in the law, and people really are confused. There's really a sense that some people think the law has been repealed. They either think it's been repealed or they aren't sure. About half of Americans think that after the 2010 elections and the reaction about the passage of this law that so many people had opposed, and over the objections of the majority of the American people, that they think, well, it must be repealed. Just over half of Americans know that this law still stands, which is why I'm so pleased that you're here, because this law is on the books. Every day, more and more regulations are being written to implement this law. It is coming at us like a freight train, and we need to know what's in this law and how it's going to affect us. Only 14% of people think they've benefited from the law, and 17% say it's already harmed them, and 45% think it's going to make the economy worse. 55%, and probably growing, favor full repeal, and 67, two-thirds of Americans favor repealing the individual mandate. This is the requirement. The federal government is going to tell each one of us that we must purchase health insurance, what that health insurance must cover, how much we have to pay for it, and we'll be fined on our taxes. It will be a federal offense for not complying. And certainly that applies to employers as well. Just to give you a sense of what this law is about, this is actually a picture, a map, of about a third of this law. It looks like a cartoon. It is actually a serious depiction of some of the 159 new boards and agencies that will be created to implement this law. When you look at the circles, they really are representative also of the power that's given through this law to various constituencies. Look who's at the center of the universe, the Secretary of Health and Human Services, where it says in this 2,800 pages of legislation, several thousand times it says the Secretary shall. There is great discretion given to federal appointees to implement changes in our health sector, our $2.5 trillion health sector. And the Secretary of Health and Human Services is at the center of this equation. If you could see this, we actually, if you want to give me your card afterwards, I'll be happy to send you the PowerPoint of this and to send you a link to it, because everybody needs to see this. The staff of the Joint Economic Committee spent a lot of time trying to understand this law, what the connections, what the new subsidies were, and trying to figure out how this could work. This is about a third of the law. If they would have tried to put all of it on a slide, we wouldn't have been able to read any of it. You'll see when you see it, the patients are sort of an afterthought down in the corner as our physicians. And Congress actually doesn't have very much authority either now that this is in effect. This is a serious, serious law. The President wants nothing more than for us to forget about this, tell us that it's nothing more than putting 26-year-olds on their parents' policies, free preventive care, new risk pools for people with pre-existing conditions. This, in fact, is a truly massive takeover of our healthcare, of our health sector, in which every one of us is going to be affected. There are a growing list of concerns now that we begin to see how this, as Nancy Pelosi said, we have to pass it to find out what's in it. We are finding out more and more about what's in it. We detail it in our book, Why Obamacare is Wrong for America, broadside HarperCollins. You can get it on any website, any electronic or virtual or actual bookstore. We talk about how it's going to affect families and young people and senior citizens, taxpayers, employers, employees, doctors and patients, and all of us in our constitutional rights. The burdens on business are really quite extraordinary. The federal government is going to tell you as a business owner that you must provide health insurance for your workers and what that insurance must cover. Now you have a lot more flexibility in what those policies are. Healthcare costs not only are rising, but they will rise even faster as we begin to see what those coverage mandates are. Businesses, by the way, have to know the household income of their employees in order to avoid another level of federal fines. It's not just enough to know how much you are paying an employee. You also have to know their household income, because if they should go from your employer coverage into one of the exchanges for coverage, then you have a $3,000 per employee fine instead of a $2,000 fine for not providing coverage. Waivers, we've heard about all of the waivers that have been granted. The administration got so embarrassed about them that it decided to stop granting the waivers as of September 22nd, because people kept saying, if this law is so great, how come people have to give so many waivers to protect people from it, because people were going to lose their health insurance. And an analyst from McKinsey & Company has estimated that as many as 80 to 100 million people could lose the coverage that they have now, maybe be in different coverage categories, but the commitment and the promise that we heard over and over and over again, if you like your health insurance, you can keep your health insurance, is clearly not going to be met under this law. Many employers are simply looking for the exits. There is great resistance from the states, 26 states that are suing in federal court to block the law, particularly the despised individual mandate, and also the requirement that they have to cover, expand their Medicaid populations dramatically, to the point that the states say that it's going to bankrupt us. We're going to have no money left for education, public safety, transportation, if we're required to do this. The incredible complexity of this law that we saw on that chart is really daunting, and even anybody that is trying to figure this out is going to be overwhelmed, and employers are going to have to figure it out, because there are many, many things other than the individual mandate, the employer mandate, that you're going to have to comply with as far as paperwork filings, etc. Many unintended consequences, unintended would seem to be, one wonders sometimes whether or not destroying the private health sector could perhaps be part of some agenda. Child-only policies are vanishing in many states after the secretary shall, told companies that they simply have to sell health insurance to anyone who applies for child-only policies, even if somebody's on their way to the hospital to buy insurance. And companies said, well, that's not insurance, because people aren't paying in over a longer time to insure against the risk of future events. So they simply have exited the markets. As I said, 80 to 100 million people could lose the coverage they have now. Many of them are going to find themselves in the exchanges, and that coverage is likely to be very different than the employer coverage that they had. Costs are soaring. 40% of doctors say that they are thinking of leaving their practice sooner than they otherwise would have, as a result of the rules and regulations and the paperwork and the onerous restrictions that they're going to have to comply with under this law. And interestingly, the Service Employees International Union, all in trying to help get this law passed, was one of the companies one of the groups that applied for a waiver from Obamacare, saying, well, we can't provide